Yeah. Hello, everybody. This is an interview with Dr. Diego, Don Dr. Diego, who actually is hosting the Sayulita COVID Test Clinic in Sayulita. And we're just here to ask him a few questions about what he has noticed in the last few couple of weeks since this has been going on. Buenas noches, Dr. Diego.
Hello, Javier. Buenas noches. Thank you.
So Diego, just tell us, even though he looks kind of young, he's actually a doctor. What have you found? How many people have you tested in the Sayulita clinic, and what's the whole procedure? Is there anything that most of the questions people approach you with emails, calls, and all that kind of stuff?
Well, right now we start testing for the last 2 weeks. That is when the airlines required for more people to be tested. Before we were doing just on the regular office with patients with symptoms. So now we're getting patients with and without symptoms. Luckily, to say on the community in Sayulita, we've been having less than 0.5% of positive patients. Most of them, they had come with 1 or 2 symptoms, not necessarily requiring the test for flying. On the patients that we've been testing for flying, 99.5% are being negative with the antigen test. From the most tests that we've been doing, it's the antigen test through the nose swab. And we've been doing around 10% only about PCR. It's from 2 factors. The antigen test, it's quick test. You put a solution and then you have a marker on a stripe that it tells you if there is antibodies, antigens. That is mean that your immune system is fighting on the nose. And then the PCR is to see if you have a viral charge. That means that you could be replicating the virus. So both tests are very efficient to detect COVID-19. And so we are very safe on the results that we are providing, because it's been accordingly with the patients with symptoms with the positive test, and the patients asymptomatic, they've been negative as well. I think in general, even it's a requisition from the airlines. People have been feeling more safe about this procedure. And the part that most of tourists come from more than a week, and we're talking 2-3 weeks, sometimes a couple months, and that they test negative before they fly. I think it talks good about how Sayulita numbers of COVID-19 it's around. If we were saying that people in town is sick or is not taking the conventional precautions so we don't stop spreading, we will have more positive testing before flights. And that's not happening. So I think it's very positive.
Does it hurt to get a COVID test?
It's uncomfortable. Of course, the sensibility on the nose, it changes from person to person. I would say that most that could happen is that people sneeze 1, twice. It's very easy to take a couple eye drops, because the place that we go to do the swab is very close to the canal to the eye. So it's a little bit of common to feel a little bit itchiness, but all this discomfort goes away in a few seconds, less than a minute, most of the patients. There is sometimes that the patient can have an anatomical change. If they have a deviated septum, then we try to do it on the biggest one, so we bring less discomfort. But of course, some anatomies can be a little bit harder to tolerate.
Okay. So, how much time before they fly do they have to go to the clinic here in Sayulita, which is walking distance from downtown, and go take a test?
Well, the result for the quick test, it's 15 minutes the minimum, 20 to 25 minutes the maximum. If we leave the test sitting for hours, then the result is not valid. So all the reports they've been checked at 15 minutes, and the report is done at 20 minutes. From there, we sometimes take 1 hour, 2 hours to make the letter. because it needs to be coordinated with the laboratory that certified that our tests are approved by the government. And so most of the time, if it's urgent, in half an hour, they can have the result. But the average time for the antigen test is 2 to 3 hours. So we can send the result by email, so you can have it on PDF, or you can also come back and pick it up printed. For the patients that require the PCR, that's a test that needs to process on a laboratory with an equipment. So we run the equipment around 12 and 1 p.m. So all the tests that they are done before 11 a.m., we can have the results by that night if it's urgent. But in general, we have an estimated time between 24 and 48 hours. 48 hours is the maximum, and we are considering that we can have a contingency, as every laboratory in these times can have. But in general, we have the results in less than 24 hours. So the other part is that Ireland requires 72 hours testing before. So there is two things to consider there. Is at what time is your flight? And the other one is we've been having all book. Well, we've been all book all these weeks. So we have a web page where you can make your appointment. And most of the time we do have time to do walk-ins, but it's easy for everyone to do an appointment. Why? Because also the space it needs to be considered for the amount of people that we have been tested at the time.
Okay, and what is the web page?
The web page is Sayulita Covid Testing Center.com. You can find it also in sayulitalife.com. There is information around there about the web page. And sometimes if there is more than 6 or 7 patients that they are together, or clients that want to do the test, sometimes we recommend an on-site. That way we decrease the risk of many people moving around town at the same time. So we also attend groups that comes for weddings or for bigger parties for families. And that's other service that we offer.
Perfect, Dr. Diego. And if anybody has any questions, should they contact you through the website? Is there an email there to have any questions regarding their tests?
Yes, there is an email in there. They can get in contact with the assistants that they handle the emails, and they send me the information with priority, because sometimes we have questions from patients with symptoms, and we give priority for answer those. But we answer all the questions in the 24 hours, depending on their importance.
Excellent. Okay, is there anything else we should know about the COVID testing center in Sayulita and what is winter, almost spring here in Mexico?
Well, I think that it would be good that people plan their trip in advance, so they let us know where they can come and we can offer the best service for them. And also that they shouldn't be worried with positive testing. We also have the medical assessment for patients that they give positive without having any symptom. So they can feel safe knowing that we have what everyone has around the world to treat them.
Okay, yeah, that's really important. Sorry, I missed that. What happens if all of a sudden, there's almost no positives, but what happens if somebody shows up positive? They're not going to be able to get on a plane, but what are they going to?
And that is one of the concerns that we're talking with our business partners around and businessmen that we know around town, because when this happens, they need to stay at least for 14 days with a positive test prior to the flight. And after that, they will need a letter to say that they already been in quarantine for 14 days. Because when they get tested in 14 more days, more likely they will be positive, even for several weeks. So when someone tests positive, we check that he doesn't need any medical attention and that we follow the protocol for COVID patients. But after they finish their quarantine and they recover their health, they need a letter from a doctor saying or making sure that the patients are symptom-free before flying. And then another test is not required.
Perfect. So 2 weeks.
Yes, and most of the countries, especially the US, they are requiring 14 days from the day being tested.
Perfect. Okay.
So if you test on the day number 4, you can fly by the 18 if you don't have symptoms of keep being contagious.
Dr. Diego, thanks a lot.
I hope that this helped everyone to have a safe travel and enjoy some waves with you.
Claro, muchas gracias.
Al contrario, que estén muy bien, Javier. Thank you to everyone.
Buenas noches.
Good night.